students. Welcome to the next topic, the Tuskegee Syphilis study. Today we are going to learn about the syphilis study which was conducted in the United States of America on Negro people. Syphilis is a sexually transmitted disease which is generally a type of infection, and at that time penicillin was the only viable treatment available for the treatment of syphilis. And if the syphilis was not treated, it can get worse over the time and it can cause serious health problems including death also. Syphilis is STD which is caused by Treponema pallidum, and there was a problem that until 1907 no one could treat the disease. Then Paul Ehrlich discovered the salvarsan, an arsenic based compound for the treatment of syphilis using chemotherapy. Now coming to the history of the syphilis study was conducted between 1932 and 1972, almost around 40 years, in the United States of America by the United States Public Health Service, USPHS. It was conducted on the African American male, that is Negro males, and the purpose of the study was to observe the natural history of untreated syphilis. How, if the syphilis is not treated, how the human body reacts on what is the natural response of the human body in the syphilis. So the study was basically done by the Public Health Service of United States. Started the study in 1932 in collaboration with Tuskegee universities. At that time it was not a university, it was the Tuskegee Institute, which is a historically black college in Alabama states of USA. The investigators of the study enrolled total of around 600 poor African American male populations from Alabama. And of these total enrolled male, 399, around 400 was having latent syphilis, with a control group which were not infected with the syphilis having 201 male. The false promise. Why this is false promise? Because during enrollment of the patients in the study, they were told that they were receiving the incentive for participation in the study, including free medical care, because they were having the syphilis, and it was told to them that the syphilis, your disease will be cured definitely. But actually they were deceived by the primary health services, and they were not received any effective treatment. They were not received any diagnostic procedures, and what was done on them, those things were totally hidden from the populations. Hidden stories. As I told earlier, these enrolled population was never been informed for the diagnosis despite the risk of infecting others. So during the studies, the placebo or the controlled humans were also developing syphilis studies, and there was a high chance of infecting other population too, because those patients were not having syphilis in the primary phase of enrollment, but later on they also developed the syphilis, and they could infect their family members also. And syphilis is the disease which can lead to the blindness, deafness, mental illness, heart disease, bone deterioration, and collapse of the CNS, and some leading to death. These serious health problems were not being told to the patients or the Negro male enrolled in the studies. Blood. The promise was given to those population to treat bad blood, because bad blood is a common terminology which was used at that time, which is the colloquialism that describes various conditions such as syphilis, anemia, and fatigue together. And the promise was given by the Center for Disease Control and Prevention that they will be those will be treated for bad blood condition if you enroll for the study. And blood was a leading cause of death within the Southern African American community. Therefore, many subjects were getting enrolled for the studies because of this false promise given to them. False duration. Why? Because initially it was told to them that the study was only going to last for 6 months, but it was extended up to 40 years. So you can now imagine how false promise was given. 6 months actual duration and 40 years the actual study conducted. Because after funding was not given for the treatment in the study was supposed to discontinued without informing the man, and study was discontinued. But the investigator then realized that if we do not inform the patients or the enrolled subjects, we can continue with the study. So they decided to continue with the study without informing the man and without informing that they will never be treated. Despite of available treatment of syphilis, that is penicillin, by 1947, but the investigator did not treat the syphilis in the patient with penicillin. Here the negative role of clinicians is surfacing, because study clinician could have chosen to treat all the syphilis subjects and close the study, and they could split off a control group for testing of penicillin. Instead, they continued the study without treating the participant. They withheld the treatment and information about it from the subjects. They also prevented participants from accessing the treatment of syphilis available to the other residents in the nearby area. So they also prevented participants of the syphilis treatment from the other sources as well. The study continued under the numerous public health service supervisors until 1972, and then there was a press leak. There was a leak in the press about the study, which was resulted in the termination on the 19th November of 1972. The victims of the studies, all African American male, included numerous men who died of syphilis, and 14 wives of those men contracted the disease, and 19 children born with the syphilis. Conclusion of the study: the 14 years of Tuskegee study of untreated syphilis conducted in United States of America was a major violation of the ethical standard. Researchers knowingly failed to treat participants with the penicillin drug for the treatment of syphilis, and they hide the truth that they were never be treated for the syphilis. But at the end, all good things happened. The revelation of the study's failure by a whistleblower, the Peter Buxton, led to major changes in the United States laws and federation and regulations concerning the protection of participants, that is humans, in clinical studies. The Tuskegee Syphilis study is cited as arguably the most infamous biomedical research study in the US history of mankind, led to the 1979 Belmonte Report and the establishment of the Office for Human Research Protections. It also led to federal laws and regulations requiring institutional review boards, that is IRB, for the protection of human subjects in studies involving them. Now studies require informed consent, communication of the diagnosis, and the accurate reporting of the test result. You could believe that on 19th May 1997, after the closure of the study, after around 25 years, President Bill Clinton formally apologized on behalf of United States to the victim of the study. So this is again a major example, one of the black example of the human clinical trial which was conducted on the black Negro people of United States, African American people, without taking concern and willingness, without reporting them the treatment and the diagnostic procedure which were doing on them. So this is all about the topic. Thank you.